My name is Jo-Mel Labayog. I'm a hematologist and oncologist at the President's United Samaritans Regional Cancer Center. So the Cancer Center has recently been renovated. It has become more patient-friendly, more patient-accessible, and we certainly respect the privacy of the patients. So we've renovated to meet those needs. We have state-of-the-art technology. We have a radiation department which is first rate. They have IMRT, they have IGRT, and what they are is that they are state-of-the-art technology that allows radiation to be more focused, with less side effects, and overall to make it a more efficient and more comprehensive type of therapy. We also provide chemotherapy here as well. And with the most state-of-the-art medications and most recently FDA-approved drugs. We have our own CAT scanner here. We have our own lab draw where the people can come and get their blood drawn here. Any CAT scans or x-rays that we need to do, we can do on site. We have people from the dietary department that come here. We have people from the physical and rehabilitation center that come here as well. We have pastoral care that comes here. So again, we have if there's such a thing as one-stop and shop things for cancer care, we do quite a bit of it. Why you should come here versus anywhere else? I think because then it's more personal. We know you by your first name. My medical staff is excellent at taking care of the person's needs and the family. So you don't feel so isolated. I think when people come to the office and get to know us, we make it more comfortable. In the difficult time that they're going through, the last thing they want is coldness or aloofness by their caregivers. And I think that's where we provide excellent care. So that's interesting. My mother was an educator. And so I became interested in a number of things, but the human body became one of them. But she's also wanted a doctor in her family. She herself wanted to be a doctor, and so I was the last of her children. And since I'm so gullible with things, I decided that, okay, I can be a doctor too. During my medical school and residency training, it wasn't until I decided that oncology or cancer care was something I wanted to do. My mentors in that specialty, I believe, are the most human of all specialists. I think they not only care for the disease itself, but the person in total. You get to know the patient, you get to know the family members, towards the end of life, so it's encompassing. You get to know the person better, not just an organ or the cancer itself. So by living in a smaller town, you get to see things more clear, not only about the medical care that you receive here, but also the community itself. I think by living in the community is important because then you get a flavor and you have a better investment into the community and to the patients and where they live. Certainly travel time is always an issue, but the most important thing is I think you get to know each and every one of the physicians and the healthcare providers that live here, so your connection and your communication becomes much easier. When you're in a bigger city and there's 2 or 3 hospitals, it's very easy to get lost and to get fragmented in your care because you're not exactly sure what is happening across the street. But here in this town, having one hospital does have great advantages. So after training, I was offered this job here in 1997, me and my wife, and we didn't have kids yet. But we lived here ever since. Now I have 2 children who go to school here in town. My wife is an oncology nurse herself. But we spent all our years here, since 1997, again because we feel it's important. It's important that you live where you work, And that's the only way in which you can invest and give your utmost attention to your job and also to your family.